Burdette. All right, so let me
Hello.
move on. Hey, how you doing? So let me give you
Hey.
equal time. It's www.dunwoodylabs, isn't it?
Yes, it is.
Okay. This is non-CME, so I can advertise all I want to, girl.
Well, I really appreciated your kickoff in Atlanta and the people that were there with me for Dunwoody, Cass Dooley and Brian. We all just felt like, wow, what a community. And Atlanta has been ready for an event like that, so I'm glad that we have one. And from Oxendine talking to us about the legal side, really boosting us up in terms of community, and Dr. Lord, who's a great mentor of mine, amazing lecture there, and Dr. Zava, I have to agree, I always learn something when I listen to him. I thought his lecture on hormones, comparing salivary, serum, capillary, was one of the most balanced presentations of a huge bulk of literature out there. So it was just an amazing experience.
And I think the great thing about his lab is that he does them all.
All of them,
If you talk to someone who has a saliva lab, they're going to tell you how great saliva is. You talk to someone who has a urine lab, they're going to tell you how great urine is. He does them all, so he doesn't matter what you send him. He can extract what you need out of it. So that's great. So but all right.
I'm excited about it. I just real quick too. I'm really excited about his 4-hydroxyestrone through urine because very stable. And I just also wanted to add to that. We do some oxidative stress testing, and they're a nice one too, because I do think that there's a lot of data that talks about an environment of high oxidative stress will also shunt that estrogen towards 4-hydroxyestrone, will inhibit methylation, so some of your COMT activity there, and will charge any estrogen, estradiol, estrone, and make it more reactive with the DNA. So that's some really cool work that he's got going there too.
Yeah, and it allows you, when you look at it like that, it allows you to know what you need to emphasize with the patient. If you see that's the issue and that's the key that sends it down the wrong pathway, you say, hey, look, I don't care what else you do, but you got to take your antioxidants. You got to do this instead of, because sometimes I think, at least, clinically, patients get overwhelmed, and you really have to really be able to tell them this is the important thing. See this?
Exactly.
These are the two important things that you got to do. Now you can take the other 6 things, but you have got to do these 2, or we've got to do this IV, or we've got to get this in because we know this pushes this in one direction or the other. So all right. Well, tell us more about Dunwoody Labs. I know we were talking about Zion and all of those kind of things. Because
Dunwoody, we have, we do a comprehensive number of profiles, but we've been very gut focused, and I think that is often an important component for functional medicine practitioners. And just like you were saying, you have to identify what's important for the patient, or you'll lose them. I bet we've had that experience where we've maybe done some food sensitivity testing, and it either comes back with everything positive, and they know they don't react to every food, or possibly the other end of the spectrum, nothing's positive, and they know when they eat a certain thing, they get more bloating or brain fog. And so we don't want to risk losing them. Oh, this information doesn't apply to me. Never mind everything else you say either. And so I've been real excited with kind of basing things around cutting-edge research in the gut, and then also I'll talk a little about the food sensitivity at the conference in the previous conference that we had. There I spent a lot of time talking about things like diamine oxidase, and so I talked about a profile that we have that, while it's never this simple, looks at 3 basic ways to identify basic types of leaky gut. So one marker that we measure is zonulin, and zonulin is a biomarker that we can measure in the blood that tells tight junctions in the gut to open up. And Ellie was just on there. Hey, Ellie. And so Pisano is the researcher who now works at Harvard who introduced this marker, zonulin. Ellie's actually brought him to town, and so he's going to come tell us firsthand about his research around this marker. I didn't do anything as smart as to figure it out, I just basically read his published research and have duplicated what he's published out there. And the cool thing about zonulin is it goes up before autoimmune conditions, before allergies, and before even certain cancers. So we can use this zonulin to see if we're on our way to leaky gut. And if it's high, again, it tells tight junctions to break apart. It mediates that leaky gut phenomenon. So I put it on a profile. So that's one of the things on the profile. And zonulin tells tight junctions to open, allowing all those proteins to flood through, activating T cells, increasing inflammation in general. Another marker on there is called diamine oxidase. Perfect, there, that's the profile. And that diamine oxidase is the enzyme that degrades histamine. This is fascinating to me because on one hand, we can use it as another way, another marker of leaky gut. You make it in the microvilli. When we have a nice competent gut lining, you produce lots of it. It should be in that nice green zone over to the right. However, if your microvilli have eroded, like NSAIDs, you'll produce less diamine oxidase. And so this is another way we can have leaky gut, just erosion through the mucosa, not zonulin mediated, just straight up ulcerations at its worst. And so now, within this month, there'll be a third marker on this profile, lipopolysaccharide, and that is bacterial endotoxin. So when we have a dysbiotic gut, you'll have more of this endotoxin, but this will come through the cell, transcellular transport, and that too can become dysregulated. And so it's another way that we can have leaky gut. And to some degree, there'd be distinctions in treatment as well. If there's LPS, if there's a bacterial endotoxin, I'm going to use maybe some berberines that have antimicrobial activity. However, if zonulin's high, I'm going to possibly use some immunoglobulins that are found in breast milk, or that we can give IV to help someone who's immune compromised because it blocks zonulin. And if diamine oxidase is low, I'm going to give good glutamines. I'm going to think about something like Dr. Taylor's 6-point gut repair. When these things are off, it's going to require a more complete program to get them back to where they were, and possibly even just use the supplemental form of some diamine oxidase. So that's one change that's happening on this profile. At our next conference, I'm going to spend some time talking about food sensitivity. And so hopefully, just like Dr. Zava does such a good job of being representative of the research out there, I too wish to do the same thing. I do a specific type of food sensitivity, measures all 4 subtypes of IgG, as well as a complement antigen that's food specific, C3D. That's important because it's a whole nother way that we can have inflammation due to food. However, that's not to say that our other methodologies out there are invalid or bad or wrong. They're different. So, for example, an IgE, a true food allergy test, is absolutely valid. If somebody is going to eat something and go into anaphylactic shock, and this test can tell you that and prevent that from happening, very valid indeed. However, often the people that seek out functional medicine docs who are looking for that next level of answer, they've already figured out these immediate reactions because it's easy. You're exposed, you eat it, you react. It's these delayed sensitivities that get more difficult to tease out because you can have these reactions 3 to 72 hours afterwards, after you're exposed to something or eat something. They can have a cumulative effect, so it can be a synergism between 2 things you eat. And they result in more kind of insidious symptoms, things like fatigue or joint pain or headaches. Essentially, they're a way that inflammation in the body gets increased. So if we're treating a condition or pathology where we think it makes sense to lower the inflammatory burden, then removing foods that people eat that their personal immune system react to helps to lower this inflammation to make things from MS improve, to fatigue, to weight gain, to depression. If inflammation, lower the inflammatory load. We could do that through something like endomethasone, which will destroy your gut lining, or we could do that through changing diet, helping people pick good foods that matter. Just like Dr. Zava said, it's not that we don't know these things are good for us, but getting validation, seeing something personal about our biochemistry is very motivating. Now I know I got to eat more broccoli. I can't eat gluten. We start to figure these things out. And so, again, there are other types of testing as well. There's also, for example, IgA testing, also valid, but more about reactions that are happening at the mucosal membrane until we get leaky, and then you can get systemic symptoms from that too. So we're going to walk through some of the differences, pathologies that you would expect to see, more IgG, IgA, even IgE, what parts of the immune system that triggers, and most importantly, what we can do about it, because there's a lot we can do about it. And, you know, award-winning, Linus Pauling award winner, Fasano, who isolated essentially a marker of leaky gut, is now at Harvard pursuing this research. And again, it's exactly what we've said. If you change the gut, you change the course of pathology. So really fun stuff to get to introduce. And again, I'm not so smart as to figure it out myself. You can tell Dr. Zava is just classic scientist. He wants you to, you know, he's very clear about, is it mass spec, is it tandem, mass spec, et cetera. So really good, clean science there. Me, I'm more on the clinician side and work with patients, and I've done integrative medicine. And then when I see something in the research like diamine oxidase or zonulin, I run over to my PhD and say, oh, could we do this? So in the case of the food sensitivity, that was an example of that. And so the guy who developed this, he postdoced at MIT and Harvard, and he was the one, he worked on the polio vaccine, and what he saw from immunology research there was that complement was another key way that the immune system reacts. That complement really drives these reactions. So then he applied it to food. Is complement also food specific? Found the answer to that to be yes, and found when you combined that with IgG testing that you got a much higher level of specificity and sensitivity. So really good data when you split the sample and you run them both that day, or when you split the sample and run one that day and one 9 days later to account for shipping. Real high confidence intervals, 97% or more, which is one of the problems we've had as clinicians with food sensitivity testing. Is it reproducible? Does this truly represent what's happening in my patient? Because we have to get that buy-in, that confidence that, you know, allows them to say, all right, it's worth it to me to change my diet, to exercise a little more, and to be mindful of this piece.
Yeah. And, you know, that's what I found with your results, Dr. Burdette. And again, you know, for me to bring this to a patient, I have to really understand it. And that makes sense that what you're testing is something that has all of the elements to start the inflammatory process. You know, everything is there. When you put the complement there, okay, everything is there. These are the most likely things that are really causing a problem. You're right. It is very hard to tell somebody, you know, do not eat these 77 foods, you know, so that, you know, they're, and so, you know, what I usually do is I do some other tests just because it has more foods on it, but I only look at the major ones. This is the one I tell them, these are the things you really got to pay attention to, are the red and the oranges in yours. And then I'll look at one other one. I'll say, well, okay, let's see how much these overlap. And most of the time they overlap well. And then sometimes if I'll see some major ones, and I'll say, you can try this, but this makes sense to me. Everything is there. You test it. Everything is there to start the inflammatory process. So you assume that it's doing that. And then I've got to, and I'm just as slowful as I tell other doctors, I've got to get myself to look at the zonulin and diamine oxidase. I've got to start ordering this so I can feel comfortable with it. But that makes sense also. Are the physiologic or the pathophysiologic processes in place to make this really be a problem? Not only is it inflaming the gut, but it's also causing a problem systemically. So, you know, all of that makes sense to me. Now the zonulin, is anybody else doing zonulin
There's some other good work going on with it, but it's not zonulin specifically. The only other lab that I know that is making a measurement around that is measuring some zonulin antibodies. And again, I don't have as much experience with that. Well, you know, negligible, obviously, compared to zonulin itself, because that's what I run. So, but when I went to the research, what I found in these studies from Fasano and from others, when they were seeing high zonulin, a marker of leaky gut, being predictive of things like autoimmune conditions or even type 2 diabetes, it was zonulin specifically that was measured and not the antibodies. So that was my reason for measuring zonulin. Some people have had the concern that maybe it's not stable, and so that did not bear out in the many trials that are done with this specific methodology. And then, of course, one thing I like to do is turn all the lab employees into guinea pigs. And so about 20 of them all got to we took their blood, we looked at zonulin in the morning, we looked at it in the afternoon, we looked at it at night, we looked at it 4 times that day, fasting. We looked at it 4 times the next day, not fasting. I know I made them into human pincushions. I bought them lunch for this at least, though. And then we looked at zonulin once a week thereafter, and we found very good stability with it. So I feel comfortable that regardless of the time of day, you're not going to see, we did not see lots of highs and lows in terms of variability there.
All right. So, very good. So, again, I can't wait until November. Always great to talk with you, Dr. Burdette. And let me see if there's anybody else who has any questions. And it's DunwoodyLabs.com. Let me go back to your homepage. Do a little bit. So, it's DunwoodyLabs.com. Anybody who's not from Atlanta. Dunwoody is a part of town in Atlanta. And tell people why you switched to Dunwoody Labs.
Yeah, I do call myself Nutritest because I thought in the name you might want to identify what you did. Nutritest. We had a lot of nutritional testing, but Oxendine, who is a former Georgia insurance commissioner who gave an amazing talk at your conference, really made you want to stand up and fight for doing crazy things like helping people with changing their diet. But anyway, he said putting Nutra in the title was like painting a big red bullseye on us, and that insurance companies would come after us for just that. So he advised to pick the most boring name with the least meaning possible so that we'll continue to be reimbursed by insurance.
Yeah. No. So Dunwoody is a part of town. It's actually where my office is. It's a nice part of town. You should go out there. There's a lot of nice shopping and all that stuff out there. So if you're not from Atlanta, you're like, what the heck is a Dunwoody? But hey, it's all strategic. It's advice from John Oxendine. That's what I'm saying. Hey, you want to stay out of trouble, you pay Oxendine a retainer. And he'll tell you how to get out of trouble, how to stay out of trouble. So this is just one of those other. We had him on our last webinar, just to kind of a follow up. So all of us around here we use John Oxendine. So all right, Dr. Burdette, it's 8:56. Thank you so much for.
Yeah, my pleasure. Thanks for doing this.
Oh, you're welcome. You're welcome. And we also recorded this, so we'll send it out. Because, again, we want to support the people who support us, so we appreciate you supporting our conference, and we want to support you and your lab as much as we can.
Thank you so much, and thanks for supporting all of Atlanta physicians and nationwide.
Oh, you're welcome. You're welcome. Okay. All right, then, Dr. Burdette, we'll talk with you soon.
All right, take care.
Okay. All right, bye-bye. All right, Pete. This is it, Dr. Hams. I'll email you, or you can call me. I know you had a question, but I don't want to. I don't want to not be respectful of people's time, and I've got to end this with a commercial for asthma. Or my wife will not be happy with me. Hey, Pete, you can do the commercial here. Don't everybody hang up now, all right? Pete?
Yeah, I'm here.
Okay, we'll let you
Hey,
do it.
I'll do it very, if you can pull it up very
Yeah.
quickly.
Okay.
Um,
Oh shoot, I didn't put the dot here.
Mr. Dot in there. I think we have some new attendees to our webinars. So
Yeah, we
please,
do.
if you're new to our AFMA webinars, visit our website, which a lot of people type in afma.com, which it's not. It's afmassociation.com, and take a look at our lineup for November. Our speakers, we have some returning speakers from our that actually spoke at our March conference, but we have some new speakers bringing new information to AFMA and to our members. Take a look at our schedule. We are in early bird registration, so you can save on your registration fee now. Also, we have our Hyatt Regency Atlanta hotel link on our website. If you just click on hotels on our website, or hotel on our website, you can actually reserve your rooms for the conference, which isn't a bad thing to reserve it now. You always can cancel, but in March, I think people waited till the last minute and could not reserve a room. So don't wait till the last minute this time. Join us. Again, great lineup, great information, bringing new ideas, and some new vendors. Our exhibit area has expanded. Same space, but we're adding more services, more companies, more devices, and I think you're going to find it to be very slightly different than March, and we definitely would love to have you there. If you're new to our webinars, we try to do these twice a month, every 2 weeks. Our next webinar will be May 27th, which is I think 3 weeks away. Dr. Taylor's daughter is graduating from high school, if I have that correct, on the 20th of May. So our next webinar will be May 27th, and we'll bring some new ideas to you on that webinar also. So thanks, Dr. Taylor, and okay. I'll cut it right there.
All right. And I do appreciate the new people. Dr. Sermons, I see you're there. I'm not going to open up the mic, but Dr. Sermons, the OBGYN here in Atlanta, who I've known for a long time. And I see some other Dr. Joseph, Dr. Gittner. These are all new people. Kerr, Mellenbacher, a lot of new people, and we really appreciate you coming. And I also want to thank our tried and true Dr. Pickler and Dr. Babineau and Dr. Campbell. And you see, I want to go back. We try to grow our own around here. We don't try to have big eyes and little U's. Dr. Campbell is going to be speaking. She is somebody who you probably saw at the last conference, but she's somebody who, again, practiced regular old medicine, and I think we met each other sometime in the past, and she got interested in this and is really an expert on a lot of things in functional medicine. Dr. Andry is another person who has been a past attendee, and he's going to be speaking. George Gilson is somebody who he has a lab in Canada that I've heard him speak several times when I was speaking with PCCA. Who else do we have? I thought we had another homegrown. We heard Dr. Goodyear last time. So, hey, and I think I'm only speaking once. I don't want this to be I'm speaking twice. My hormone replacement by the book, but I don't want this to be, Dr. Taylor organization. This is not a Dr. Taylor organization. I'm going to run out of things to speak about here in a little bit. And if you have something that you are well versed at and you want to speak in the future, I think on the website is a place where you can send abstracts. because we're looking at March or April 2015. When are we planning on having the one in 2015? In March or April?
We're going to the last weekend in April we'll have our spring conference, and then around the same time in November, I think it's November 5th to the 8th, 2015.
Okay. And we decided to do a little bit later in April to make sure that the weather around the country is more conducive to traveling after this bad winter. I think we were thinking about it this year, but it just we couldn't get a room in time. So now we know the plan, because these big conferences are planned a year or 2 or 3 years in advance. So again, we're learning all the time, right, Pete?
Yeah, yes, we are. We're getting better at it.
Yeah.
Just the whole process of putting on a conference and finding space, and what we're looking at in 2015 is expanding. So, we really don't want to be in the same location. We're really working with the hotels, trying to find a larger lecture hall, larger exhibit space, and there are other conferences going on around the same times, and everybody's jockeying for that limited space here in Atlanta. So it is. We're getting better at it, and going to continue to put on a great show, like Dr. Burdette said. March was great, and November is going to be better, and we're going to continue to improve on it.
Yeah. Okay. Well, all right, you guys. It's 9:04, and the NBA playoffs are going on, so we've got to get off the phone, you guys. So it's been a pleasure. I hope you enjoyed hearing from Dr. Zava and Dr. Burdette. And do you know who the speakers are going to be on the 27th yet, or are you still working on that?
Dr. Taylor?
Yeah.
Say it again. I'm sorry. Yeah. I heard. I caught the last bit of it. I'm sorry. I was looking at the Miami Heat game. I'm sorry about that.
Yeah, we got to get off the phone. Do you know who the speaker's going to be on the 27th?
I'm still working on the 27 speakers, so I don't have them right now.
Okay.
I'll send out that information as soon as I get those 2 speakers set.
Okay, great. All right. Well, good night, everybody, and we'll speak with you soon. All right. Bye-bye.